to talk about two surgeries which are fairly common here at Pure Plastic Surgery. As you know, probably my number one surgery, what I do the most, is your BBL and all the different variations of that, whether it's standard BBL, skinny BBL, South Beach butt lift, and then of course now a lot more of your BBL reversals or reshapings as well. But probably my second most common surgery is the what we were calling the Mami Makeover, but now, because we're right here in Miami, we're going to be calling that the Mami Makeover. That's right, the Mami Makeover, which is a combination of different surgeries, which you can do. You can combine all these things in one surgery and really get a whole bunch of bang for your buck for that specific surgery, okay? And I'm going to talk a little bit about what makes it different from your typical or standard Mami Makeover, okay? And we are in May, so still kind of the month of Mother's Day, right? Which is why we're talking about this. But the one thing that I want to say right off the bat is that this procedure does not mean that it's only for mothers or moms, okay? It's of course for anyone that needs this combination of procedures, okay? So the Mami Makeover is kind of like your standard or typical Mami Makeover, but now with curves, right? We're really going to bring out that hourglass figure, all right? So what is it going to include? All right, so it's going to include a breast surgery, okay? Now the breast surgery can be whatever it is that you need from the breast. So it's going to vary from patient to patient. So you're going to have your breast augmentation, or it can be a breast lift. It can be a breast lift with implants, or a breast reduction, which of course always carries a lift, okay? So those are the different potential breast procedures that you can get. And that's going to depend on the patient, and that's also going to, of course, change the amount of time and effort that it takes, and of course then therefore it also changes the price. So I often get, especially on Instagram and TikTok, I get a lot of direct messages, and they're like, hey doc, like how much for your Mami Makeover or your Mami Makeover now, hopefully, how much is that going to be? And well, why I'm able to give you like some approximate guesstimate type of price, I'm really not going to be able to give you the exact price, because it's going to depend on what type of breast procedure you're going to be. It's also going to depend on whether you are going to add the fat transfer to the hips, which we'll talk about here in a little bit, or something else, right? So really, in order to get the best quote, you really need to send in your evaluation. And where are you going to go for that? Everyone knows, right? You're going to go to our website, right? You're going to go to www.pureplasticsurgery.com, and you're going to hit the little token that says start your journey here or virtual consultation, and send in all that info and your photos so that we can do that evaluation. All right? Okay, so certainly it's going to include the breast procedure. The next thing that it's going to include is your tummy tuck. Okay, so the tummy tuck is the next big procedure, which is typically also for most patients the full tummy tuck. But here it's where it can also vary a little bit as well, right? It could potentially be a mini tummy tuck if you qualify for that, or a reverse tummy tuck, or it can be an extended tummy tuck. And in the most kind of severe cases, those that have had massive weight loss, I'm talking over 100 pounds of weight loss. Sometimes for those patients, we will do what's called a fleur-de-lis tummy tuck, which is where we're really removing a ton of excess skin, including up in here in the midline, and so it does have that long scar that kind of goes up and down through here. Again, typically only reserved for patients that have lost potentially 100 pounds or more, so that's certainly not for everybody, okay? But yes, there are going to be some variations on the tummy tuck as well. What we will always perform as part of this is, of course, your muscle repair. So either due to weight fluctuations or because the muscles have either separated or become weak, they need to be repaired, okay? And so we call that plication. That's the technical term. So you will have your muscle repair, and so that it's all the way. It's all the way from the top, so all the way from up here, all the way to the pubic area, a complete muscle repair. If you happen to have any small hernias along that path, they will get fixed as well. And also your belly button hernia. So that's something to keep in mind. So if you have any small hernias along that path in the midline, or a small belly button hernia, we can fix that at that time, okay? And then the liposuction. So of course we can't do, or at least I do not recommend, and we should not do a full lipo 360. I think that is way too much. Complications rates go way high. Complications of bleeding, of the skin dying, it's called skin necrosis, wound complications, and of course the risk of blood clots in the legs or in the lungs. All that goes way high when you combine lipo 360 with the Mami Makeover. So we're not going to be doing a full lipo 360, but we are going to be doing liposuction to the flanks and the waist area. So all along the flanks and all along the waist there, all right, to really kind of snatch that waist and bring out that hourglass shape, okay? And then last, what really makes it a big difference, and I've been liking this a lot when we've been doing more and more of it, is we're adding the fat transfer to the hips, right? So we are doing lipo all along these areas. We're getting at least, we're getting about 1,000 cc's from there. And why just toss that in the garbage can? Why not use that? And so we can use that fat to then transfer over to the hip areas to really bring out that beautiful hourglass shape as we shrink the waist down and pop out the hips, okay? So that's it. That's your Mami Makeover right there in a nutshell. And then there is one, or at least one more thing that we can add. I had this case here earlier today, which is what we call the Trifecta Perfecta, right? So what is the Trifecta Perfecta? Well, you do all of this stuff, everything here included in the Mami Makeover, plus your arm lift, okay? So we can do the arm lift at that time as well. Arm lift for brachioplasties when we're actually surgically removing the skin. And so that means that you are going to have a scar that will go from kind of the elbow region down into the armpit. But that can certainly be added. There are some patients where we extend the arm lift because they also have a lot of excess skin down here. So sometimes you can extend it down through kind of that lateral chest area and then down into that inframammary fold, that lower fold of the breast, and it kind of combines with your breast lift there as well. So really, really contouring the body to go from that SpongeBob SquarePants type of shape that you sometimes get with your massive weight loss or after multiple pregnancies, and to turn that SpongeBob shape into the more that Jessica Rabbit hourglass shape, and just removing all that excess skin and tightening all those muscles, and really making you look like a mommy once again, like a mommy before you were a mommy. There you go. All right. Okay, so that is the combination there. Now I'm happy to go over any questions that you may have.
We have a lot of questions, Doc.
All right, excellent.
Yes. Well, let's start from the first one. Well, the three first questions are about pricing, so let's make it easy.
Great, yeah. So like I was saying before, we get a lot of questions about pricing. And like I said, I would love to just say Mami Makeover is X amount of dollars, okay? But the issue is, like I said, there are all these variations that are there. And so I can't give you a specific price, right? Because, it's not gonna be the same if you need just a straight breast augmentation versus say a breast lift with implant, right? Those are gonna be two different portions of a price there. It's not gonna be the same whether you just need a full tummy tuck, say, versus a mini tummy tuck, okay? So the pricing is going to fluctuate. Of course, you can add the fat transfer to the hips. Maybe not everybody wants that, so that's also elective there. And of course, the arm lift, not everyone's going to need that as well. There are other things that we can add, which I didn't put on here, but a few other kind of common things that we can add to the Mami Makeover are, say you don't need the lift, right? You don't need the actual skin being removed, but you want to reduce the size of the arms. Then we can add arm lipo, and if you have maybe just a little bit of skin laxity, but not too much, then we can add potentially like a body tight or a body tight procedure to the arms as well. So we can do lipo and body tight to the arms, lipo and face tight to the chin. These are things that we can add at that time.
Okay, I have tummy tuck 5 years ago, but I feel like I still need more. Some loose skin to be removed from my size. Is this can be possible or not? Like a round 2 tummy tuck.
Yes. So, sorry, just putting up the website there because, if you have any of these pricing questions, the best thing to do is to go to the website, hit our virtual consultation button, go ahead and fill out the questionnaire and send in your photos, and then we'll be able to validate that, and one of our coordinators will reach out with a more specific pricing, specific for you. Okay? Now, question was, can you do a round 2 tummy tuck? And the answer is yes, you certainly can. So I've done quite a few of these, and they can be for different reasons. One is because maybe your first surgeon just wasn't aggressive enough. That's certainly a possibility, and you need more skin removal to get the result that you want. Two, maybe there was a life change, after your first tummy tuck. So maybe, you got pregnant after your first tummy tuck, or there were big fluctuations in weight after your first tummy tuck, okay? In which case things gotta stretch out, the skin doesn't bounce back, now you have more excess skin again, and you can come back for that second tummy tuck, okay? And three, maybe it's just time. Like maybe you had your first tummy tuck when you were quite young, say, 30, and now you're 55, and of course, gravity does its thing, the skin quality changes over time, and so you're in need for a second one. So all those are potential reasons, but yes, it can certainly be done.
Okay, Doc, this is about availability. So how far are you booking? There's a waiting list. I want to do this in June. There's any chance?
Okay.
June?
So I was gonna say hey, yeah, but June we're super booked in June. I actually don't know that I have any spots in June. I think they're telling me back here, they're nope, no spots in June. All right. In July, for me, it's actually looking fairly full, but I believe, Dr. Wigger, Dr. Vidal have a couple of open spots left in July. So really for me, we're looking at August. So I'm a couple of months at least booked out. August, I still think has a few spots that are open there. So that's probably going to be the earliest date for me.
Okay, is a better version the Mami Makeover, or is just another thing different from the Mommy Makeover?
So I'd like to think it's a better version of it. I mean, it's certainly a version of it, right? It's not something that I would say is like a completely different surgery, but it's certainly, I believe, a better version of it that we do particularly here, at Pure Plastic Surgery, all right? So many of the complaints that I've seen out there, and we see them, of course, in our social media and our messages, people that have had kind of your standard mommy makeover in other states, a lot of times, especially with the tummy tuck part of it, they complain that they still look kind of square, kind of rectangular or boxy. And so I think that's what really, and of course they're not happy with that. And they're like, okay, yeah, all the excess skin was removed, and that's okay, but I'm not really happy with my shape. I still don't feel comfortable wearing that two-piece swimsuit or bikini. And so that's where I think this is different. Yes, it's a different version. I think a more advanced version, a better version, where we're really taking into account, trying to bring out that underlying shape, bringing out that hourglass curve, okay? And that's why the combination of how we do the lipo all along the flanks. So in the flanks, we start pretty high up. So from here all the way down, so all along the sides, the flanks and the waist, and combining that with some fat transfer to the hips will really bring out that hourglass shape that a lot of times is lost after pregnancy, okay? Because what happens with pregnancy? Everyone knows? Yes, sure, everyone knows that, you're pregnant and the belly grows and things kind of grow out that way. But a lot of people don't know that it also actually affects kind of the fat along here, and then it affects actually the hip area. And so whereas you may have had like a nice curvy or hourglass shape before pregnancy, after pregnancy, even once after you've had the child and everything else, a lot of times the body doesn't bounce back, and so the body ends up looking more rectangular or squarish, okay? Even if you head back to the gym and you do your diets and exercise and everything else, okay? Because the pregnancy has forced change upon your body in both the kind of the more superficial with the skin and the fat, but also it has produced changes at the skeletal level. So at the level of the bones, the pelvis, the hips, the skeleton, okay? And so we got to do quite a few things to try to bring out that shape once again.
Okay, Doug, I need a tummy tuck with muscle repair, but I'm so scared.
Why? My question, why are you so scared? So tummy tuck, very, very common procedure. Of course, like I said, muscle repair is included with all tummy tucks. And It's something that we do here pretty much every single day. Okay. So what can we do to make sure that you're safe, right? So yes, of course. The only way to have a 0% complication rate is to not do anything, right? In the same way that the only way to have a 0% chance that you're going to crash driving your car is to never drive, right? But there are things that can be done in order to minimize that complication rate as much as possible. So number one, you want to make sure that you go to a surgeon that has a lot of experience, right, in doing these procedures, and that's well trained. So like a double board certified plastic surgeon, right? So very well trained, a lot of experience, over 10 years of experience doing these procedures, hundreds if not thousands of tummy tucks under my belt. So all those things are important. You want to go to a safe facility, one that is certified by, say for example, the Joint Commission, which is the highest level of safety certification that an OR or office-based surgery facility can have, which is what we have here at Pure. So you want to do your research, right? And then there are things that, what is that we worry about the most of the tummy tuck? Well, the thing that we worry about the most of the tummy tuck is the potential for a blood clot, okay? So blood clot that can form typically in the back of the leg, and from there sometimes it can go to the lung. So that's called a DVT, or deep vein thrombosis, and then if it goes to the lung, a pulmonary embolism, okay? So we do quite a few things here to try to minimize that risk, okay? One is that we give you a device for your legs. It's called the VenaPro. It is a sequential compression device, and what that helps is keep the circulation moving. And so you're going to be using that when you're sleeping or when you're during the times that you're not being very active. And if you're from out of town, as a lot of our patients, actually most of our patients are, you're going to be using that on the plane when you fly home as well. All right, so that's number one. Number two, this is where you come in, right? As a patient, you got to do your part. You got to walk. You got to move around. So you got to walk at least 10 minutes every hour. 10 minutes every hour throughout the day while awake, okay? And then number three, for those patients that are, say, a little bit higher in the BMI scale, say your BMI is above 30, or we're doing a longer case, maybe like the Trifecta, then we may also add an injection called Lovenox or enoxaparin, which is a blood thinner, and sometimes we add that as well.
Okay.
So don't be scared, we got you covered.
And this is important, is related.
Yeah.
What's the percentage of blood clot happening?
Right, so the actual percentage, fortunately, is very, very low, okay? It's less than 1%, okay? But, the reason why we worry about it so much and we try to reduce it as much as we can is because potentially it can be very, very dangerous, right? A lot of times, if it's gonna happen, it may put you in the hospital and sometimes in the ICU, and in the worst cases, which fortunately almost never happens, but it can, it can lead to potential death, okay? So we have to be very cognizant about it, both the surgeons and the patients, right? And in doing everything that we can to minimize that risk. Like I said, we have to work together. So you have to make sure you're wearing that VenaPro device. You have to make sure that you're not just laying around all day, that you're up and walking and moving about, okay? And if we give you the injection, you have to make sure that you do your part, giving yourself the injection once a day, every day for at least a week or so. Okay?
Thank you, Doc. My son is getting married in December. Do I have time for a mommy makeover?
So, son is getting married in December. You have time, but you got to start now. Like, I'm saying, once you get off this live, go to the website, okay? And fill out that form right now, okay? Because we need to get you in, and like I said, probably the soonest I'll be able to get you in is about August, and then you're gonna need at least a good 6 weeks before you can start regular activities. But if you want to be super comfortable, maybe 8 to 10 weeks. So yeah, it can be done, but you gotta start right now.
Thank you, Doc. This is a comment.
Yeah.
Trust Dr. Earle. He'll give you the body you desire and the most safe way possible.
That's right. That's right. Thank you so much for the comment. Really appreciate it. Safety is our number one priority. That's what we're known for here in South Florida. Not only here, just about throughout the entire U.S. So yes, that is our number one priority, and we will get you back to your family safely.
If you already have an appointment scheduled for surgery and you decide to add more, I think she's thinking about adding the arms.
Okay.
When would be the best to make this decision?
As soon as you've decided, so as soon as possible. So if you're already scheduled with us and you want to add, say for example, the fat transfer to the hips or an arm lift or something else, yeah, go ahead and reach out to your coordinator. All right, we have that super simple system. We have a system called Clara, which is a HIPAA compliant messaging system. So it's like super protected text messages basically. Okay, so yeah, go ahead and reach out to your coordinator. Let them know you're thinking about adding this on so they can give you the information and we can get everything prepped and ready for you.
So how you determine if a lipo 360 or tummy tuck is needed?
Yeah, great question. So this is something that we basically discuss at some point or another almost every single day, right? Because it's a very common question. Patients are always asking, how do I know if I can get away with the lipo 360 or whether I really need that tummy tuck, okay? So, all right, we got to look at two things. We got to look at the muscles, we got to look at the skin, okay? So, if you have muscles that are weak, then you're going to need the tummy tuck. That's it, by definition. If your muscles are weak or separated, you're going to need a tummy tuck. So you have a diastasis, a separation of muscles, or they're weak, meaning that when you completely relax, everything, I'm going to blow it out, like everything kind of blows out like that, okay? Well, that means that the muscles are weak, and so that if we do a lipo 360, you're not going to have a flat stomach because the underlying problem is the muscles, and lipo 360 does not do anything for the muscle. Okay? So that's question number one. Are your muscles weak? Yes or no? Yes, tummy tuck. No? Okay, let's keep going. Are your muscles separated? Yes or no? Yes, tummy tuck. No? Okay, keep going. Well, how is your skin? Is your skin tight, bounces back, it's like young looking skin, doesn't have a lot of stretch marks? Great. You have good skin, good quality skin, lipo 360. However, you have poor quality skin, skin that's kind of thin, papery, bunch of stretch marks, or it's very loose, it's like almost like hanging over. Well, you have a lot of excess skin or poor quality skin, then we're back to tummy tuck once again.
Okay. I'm excited. My surgery is coming up in September. Can't wait.
All right, September? Awesome. Yeah. All right, looking forward to seeing you then.
The clots happen during surgery or could happen month after you got surgery?
Good question. So typically the blood clot does not happen at the time of surgery, okay? Why is that? Because at the time of surgery, we also have those devices on your legs going the whole time. And so while it's possible, just like anything is possible, it would be extremely rare. It can happen, but it's very rare that it happens during surgery. For the type of surgery that we do, right? We do elective surgery on healthy people who are not smoking, right? No nicotine in your system, because if you have nicotine, your surgery gets canceled, okay? So healthy people who don't have nicotine, they don't have cancer or anything like that, we're doing completely elective outpatient surgery, okay? So extremely rare that it happens in the operating room. It's a little, if it's going to happen, it typically happens in the recovery phase. And why? It's typically a patient who's not being very compliant. They are not getting up and walking and moving around. They're just kind of laying in bed all day. They're not using the device that we gave them. Maybe they start smoking after surgery. Please don't do that. Don't do that. That is extremely bad for many reasons, okay? But maybe they start doing that. Maybe they left town before they should, right? Everyone needs to be here at least 5 days post-op, and they decided, oh, it's post-op day 3, I'm feeling great, I'm gonna hop on a flight. Don't do that either, okay? You're leaving against medical advice. Why? Because the risk of blood clots is too high to leave that early after surgery, okay? So there's multiple reasons why typically, if it's going to happen, it typically happens in the recovery phase after surgery, and it's usually because the patient's not doing what they're supposed to do.
Are you able to do a mini tummy tuck without muscle repair?
Yeah, so that's actually part of the definition of the mini tummy tuck. So not everyone qualifies for the mini tummy tuck because it's a very targeted procedure. All we are doing with a mini tummy tuck is reducing just a little bit of that loose skin below the belly button, okay? So we are not doing a muscle repair. We're not cutting around the belly button, what's called an umbilical transposition. So we're not moving or cutting around the belly button. So there is no scar around the belly button with a mini tummy tuck, okay? And that's actually what makes it mini. It's not so much that the incision is shorter, though it is a little bit shorter, but what makes it mini is that we're not doing all this other stuff, right? We're not doing muscle repair, we're not moving around the belly button. We're just removing a little bit of excess skin in that lower half of the belly. And the incision, this is the part that's a misconception. The incision for a mini tummy tuck will still be longer than your C-section scar, okay? So I want everyone to understand that. The incision for a mini tummy tuck will be longer than your typical C-section scar.
For people traveling, when should they plan to arrive to Miami and how long they plan to stay for?
Right, so if you're coming from out of town, you're gonna have to come at least the day before surgery, which is your pre-op. And you gotta plan to be here for a total of about 7 days, okay? So the day you arrive, or you may arrive the night before, but you're gonna have your pre-op day, then you're gonna have surgery day, and then you have to be here for a minimum of 5 days post-op. So if you add that, it's gonna be at least a week here in Miami in total.
Okay. How many tummy tucks do you do in a day?
Well, that varies on the day, but say for example, today I did 2. And yesterday I did 2. Okay. So yeah, today I did a trifecta. Anyone remember what that was? Yeah, the Trifecta Perfecta. Or para mis boricuas, la tripleta. That's what I call it in Spanish, la tripleta. So yeah, Trifecta Perfecta, and so that of course involves a tummy tuck, and then a standard tummy tuck. So it can vary. It can be it can be 1, it can be 2, it could be 3. Typically probably no more than 3 in a day.
Hola, no entiendo nada. ¿Puede explicar en español cuál es el Mami Makeover?
Seguro, seguro. Vamos a explicarlo un ratito aquí en español. Y mientras lo explico, dígame de dónde eres, ¿ok? Pero sí, el Mami Makeover es nuestra versión mejorada de lo que la gente le dice el Mami Makeover, que es lo más común, que es una combinación de una cirugía de los senos, de los bustos, y el tummy tuck, ¿ok? Removiendo la piel del área abdominal. So, con el Mami Makeover vamos a hacer tu cirugía de los senos. Eso puede ser un aumento de seno, un levantamiento con o sin implantes o una reducción. Y también vamos a combinarlo con la área del tummy tuck. Vamos a remover todo el exceso de piel en el área abdominal. Y vamos a reparar el músculo, ¿ok? De arriba a abajo. Esos músculos que están débiles o separados después del embarazo. Combinado con una lipo completa de toda la área de los costados, ¿ok? Y la cintura. Y yo creo que para resaltar esa figura con curvas, hay que añadir también una lipotransferencia de grasa al área de las caderas. Y eso es lo que lo hace el Mami Makeover, el estilo que tenemos acá nosotros en Miami, en el cual vas a salir bella con curvas y no derechita como un rectángulo. Así es.
Pero me dio risa. Doc,
Yes.
last question, but very important.
Okay.
How soon after having a baby should I book my consult?
Great. So, in terms of booking the consult, you should probably do it around 3 months after having the baby. But you won't be able to get the surgery until 6 months after having the baby. Okay. And that's for most of your most typical surgeries. All right. So think about it that way. So surgery, I won't be able to have it before 6 months. But I gotta get the ball rolling. I gotta get started so I can start, talking to the team, sending my questionnaire and photos somewhere around 3 months after having the baby. And then the other thing you gotta keep in mind is that if you are thinking about a breast surgery, okay, it's not only 3 months after having the baby, but it's 6 months after having the baby, but it's actually 6 months after you stop breastfeeding for a breast procedure, okay? So do keep that in mind, okay? So if you are breastfeeding and say you breastfeed for a year, then we gotta wait a year plus 6 months, right? For a breast procedure. Now we're doing other parts that are not the breast, like, lipo, fat transfer, tummy tuck, then that's okay at 6 months.
Okay. Well, we have like 30 seconds for a very quick question.
Sure.
When you get a boob lift, Do you also suggest to get implants?
So that's going to depend again on your evaluation and also the final look that you're going for. Okay. So if your breasts have lost a lot of volume, they become deflated because maybe you've had pregnancies or multiple pregnancies, or maybe you had quite a bit of weight loss. Then a lot of times it is a good idea to add an implant with your breast lift so that we can give you back some of that volume that's been lost and to give you a little bit more fullness in that upper pole of the breast, okay? But what we've been seeing also nowadays, by nowadays I mean 2025, kind of new trends, is that those that do have some of their own breast tissue still, you have some of your own volume, are opting to do the lift without the implants. And if you do have some of your own volume, then that's great. We can do it without the implants. And what I can do is basically rearrange your own breast tissue to move things up into this area so I can give you a little bit more cleavage, a little bit more upper pole fullness without having to use the added implant. All right, and we are set. That's it. 30 minutes. Okay.
Yes, sir. 30 minutes, 49 seconds, and counting.
Nice. Well, it went by fast today. All right, guys. Well, as you know, here's the website. Again, those of you that have big trips and weddings and stuff in December, you got to start now. All right. Do not delay any further. Okay. But anyways, I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. All right. I'll catch you later. Take care. Ciao.
Yay. Boom, boom, boom.